Yes.
Um, so, doctor, when we say headache and when we say migraine, you already said that for migraine there is a pulsation happening,
Yes.
correct?
Yes.
So here is the pulsation, but headache can be an ache anywhere on your head,
Yes.
and it is quite different from migraine. And
Yes.
is the migraine caused for women only specifically because of hormones, or can be any other reason also?
See, the migraine is a general, it is a genetic neurological problem. If I have
Hmm.
to say, it is a genetic neurological problem, migraine. But in that, there are certain types, as you say, is associated with hormones. Yes, it is associated with hormones. It is also called menstrual migraine or hormonal migraine or hormonal headache. It has different names. And
Okay.
among the people, among the women, women is more common to have a migraine than men. Men also do have migraine.
Yes.
And the women, especially in the more
Hmm.
after during the starting of the puberty till the menopause.
Hmm.
And it is when we say about this menstrual migraine, it is definitely connected with the hormones,
Hmm.
and especially the hormone which is a estrogen hormone, and which is a, when we say estrogen, it is a women hormone. Okay,
Okay.
women have this.
So usually, when you get a migraine before or during your periods, it is associated with hormones, isn't
Yes.
it?
Yes.
Otherwise, that migraine can, if it is on some other time, that migraine can be related to something different.
Yes. Yes. Of course. Yes.
So closer to the menstrual cycle, the period
Yes.
time is when you experience migraine.
Yeah.
Am I
No.
right?
Yes. Normally, the estrogen has a natural fluctuation throughout the month. Like when we call it a menstrual cycle, throughout the cycle, it is
Hmm.
generally fluctuate, and
Hmm.
it comes to the lower level just before the menses and during the menses.
Okay.
That's when the women feel this pain. Either just before they are going to have their menses, they will have this headache,
Hmm.
or during their menses. This is very typical of this period. If they feel, it is called as a menstrual migraine. Being said that, when the patient has migraine, we definitely have to rule out the other causes as well, whether there is any association with, if in case if they have, even if they don't have during the other time, it is very particularly that they are saying, but we do have to address, rule out all the other causes of the migraine, especially the neurological causes.
Neurological process. And you also said it can be genetic.
Yes.
So I'm saying I want to know about this because my mom used to tell a story about my grandmother tying a towel tight on her head and having a headache. And then the next one in the family was me who had the headache. So it can skip a generation and somebody else can have it, is it?
Yes, yes. When we say genetic, because they can have a problem with their blood vessels, that can be transferred to the, through the genes. That is why,
Oh.
if that is the cause for this migraine, then it can
Hmm.
be a genetic. It can run in the families and in the generations.
That is too late for us to find out because my grandmother died even when I was just 2 years old. So we don't know whether, but there is a, you're saying it can be genetic, it can be neurologically, we can be affected, and also it can be hormonal. And
Yes.
today we are just focusing on the hormonal part because the testing of that will be different, isn't it? How to test that.
Yeah,
So
yeah.
all the three are tested in different ways. The doctor, the gynec will tell us to go and check up with the neurologist first, and then, so the MRI basically is done for that only, isn't it?
Yeah, MRI. And also sometimes when we get a young child coming to our clinic saying that they have the hormones, we also ask them to check their refractive errors. Sometimes that can
What
also
is
be
that?
the eye problem. When they have a problem
Ah,
with the eye, the power, That can
Uh-huh.
also cause the headache. And
Mm.
sometimes when they, particularly when it is associated with this migraine, they will be noticing. So we also tell them generally to check the refractive errors,
Eyesight.
the
Okay.
eyesight power also.
Okay. Okay. Yeah. I remember that doctor sent me to check my eyesight. I do remember long time back when I had. Okay. So once we remove all those, uh, those are not the causes, then we come to the hormonal part of it. Okay.
When, how to, meaning when we conclude this to the migraine, menstrual migraine, is we ask the women to make a diary, to make a
Hmm.
calendar, and to note what she is feeling, like what she is going through, which exactly particular day, what day she is feeling this typical
Hmm.
headache, which is a migraine, and
Hmm.
what she is feeling before that, that the
Hmm.
steps which I told you, when she is feeling that and when it is getting relieved. If
Okay.
minimum of 3 months, we advise them to follow this diary. So from that we can make out whether this is only a pure menstrual migraine or it is the general meaning the migraine she has.
Hmm. A good research is done over it by journaling when, what time it is happening, and how long it's lasting. Yeah.
Yeah.
Okay. Understood. So, my next question to you is, do any of the contraceptive or hormonal replacement therapy can be a reason for migraine? Is it a side effect for it, or?
Yes, it can be. See, when we say when the patient is having a menstrual migraine, it is hormonal related. For them, it
Hmm.
will get relieved. For some women, it can be a trigger, it can cause the headache. The reason is when you say the hormonal pills or the hormonal replacement therapy, the tablet which contains for 21 days and the last 1 week is empty, or
Hmm.
sometimes they will substitute that 1 week with the placebo, or placebo means nothing, like it can be iron
Correct.
tablet or it can be nothing.
Hmm.
So when they take, there won't be any hormones, it is empty. So it is, naturally also during that time the estrogen is coming down. So that is
Hmm.
when they say it is the headache that they are having, that is called the withdrawal of the hormones.
Yeah, the withdrawal symptom. Like if we stop having coffee early in
Yeah.
the morning, and if we are used to coffee, and how we
Yeah.
have a withdrawal headache,
Yeah.
similar to that.
Yes.
Okay. All
And
right.
that also, coffee is also a trigger when you are
Yes.
taking the amount. If it is, I would say it is, literature wise, it is says
Hmm.
100 milligram of coffee and 8 ounce. If you are saying by cups, 8 ounce. If you
Hmm.
are taking more than that, that can trigger the migraine.
Okay. So my next question, I want to relate it to this one, is there are food which triggers the headache.
Yeah, food
I
some
should not say headache. I'm talking about migraine. I
migraine.
should
Yes.
say migraine because we are talking about migraine today. So, is there any food, like you said, coffee is one of them?
Yeah.
So, women should avoid certain food just before their periods?
See, actually, the coffee, chocolate, cheese, the C's. So
Mm.
these are all the triggers for the migraine.
Huh.
So it's better that they can avoid. And the another thing is skipping of meals is also a trigger.
Okay.
When we talk about the diet,
Hmm.
uh, they should not skip or they should not do fasting during that time.
Okay. You should not skip meal.
Yeah,
Okay. All right. So basically, these three C's: chocolate, cheese, and coffee.
caffeine.
I
Yes.
remember because I used to eat I loved cheese. I mean, I can't say love cheese now because I'm vegan now. But probably I remember, I thought because, there is a dish called pav bhaji in India, in Mumbai. I'm from there. And I used to think that is what is triggering. But I think the cheese in the pav bhaji which was triggering. But too late, doctor. I didn't meet you before. Otherwise, we would have diagnosed it correctly and I would have eaten my pav bhaji still. Thank you so much for that tip. that we will remember that we have to avoid those three C's. Okay.
Yeah.
So the next question is then, how do we manage this migraine? Is it important for us to medicate ourselves? Is it important for us to come to a gynac like you during that migraine, or just bear with it? What
See,
is the solution?
when you have a problem, definitely you should address that. You should not ignore, because it could be due
Hmm.
to some other problem. As I mentioned, it may not be only the menstrual migraine. It can be there could be other causes as well, because migraine itself is one complex, what we call it as a complex neurological problem. That means there could be a lot of other reasons as well why they are having a migraine,
Migraine. Okay.
because of the associated with other problems as well, what we call it as a premenstrual syndrome. During the before the periods we feel, and along with that we are feeling this headache as well, that is more bothering. That is why we are addressing and focusing and telling that I am having a headache which is a menstrual migraine, but she could have the other problems as well. So definitely she should address her problem and get help from the healthcare professional, and to
Hmm.
make sure that she did not have any other cause for her migraine, meaning
Migraine.
if we
Okay.
say this is because of the hormones.
Hmm. Whenever we usually, this is, please correct me whether it's a myth or a fact. My mom used to say you're actually having an indigestion. You're having trouble with your stomach. You know, already we said that some food are affecting, but you also said it is neurological. So if it is neurological, it doesn't have anything to do with the digestive system, isn't it?
Yeah,
It doesn't have anything to
it
do.
doesn't have,
So
meaning mainly the migraine per se there is no connection, but apart, when we say it is a premenstrual, yes, it is related. The digestion is related with the hormones.
hormones, correct. So, but when it is neurological, there is no connection there. That is a different one. And this, when it is during your period, there is a problem, then you have to look into your digestive system also.
Yeah,
Yeah.
yeah.
Okay.